Hi, everybody. Welcome to our 43rd podcasts of the REBT Advocates. And I'm Dr. Michael Edelstein. And normally we're here with my partner, Tommy Bateman, but he is tending to his wife, who unfortunately has the flu, but he's a good husband, obviously. And we are, again, lucky to have as our guest, Dr. Debbie Joffe Ellis, a author, speaker, and general promoter of rational emotive behavior therapy, and also long-term partner of Albert Ellis, the founder and promoter of rational emotive behavior therapy. Welcome again, Debbie.
Thank you, Michael. It's great to be back with you and with all the viewers. Hi.
Thank you so much for coming back. So let's start with some questions, and especially about Al and what you know about Al that most of us don't. And my first question today is his amazing productivity. Al wrote over 80 books and probably gave an infinite number of talks and therapy sessions, group and individual, and training. I was lucky enough to go to some of those and be a client of his in 1968. And Debbie, do you have any insights into how he was able to be so prodigious?
I guess maybe one of the main contributors to that was his passionate desire to help as many people as possible, and his deep conviction born by his own experience of applying to himself what he was teaching to others, of its remarkable effectiveness. So I think one of the main aspects that fueled his energy and the massive productivity was his love of what he was doing and could do. And I think I touched on in our last podcast that at times there seemed to be an urgency about him to do more, and another book, and this and this and that. And as I said last time, I don't consider that was due to any kind of addiction to work or ego or kind of workaholism at all. I think he simply wanted to do as much as he could in the one lifetime that he had. So I think a major contribution, his passion for the work, his desire to do the work, his brilliance, his genius, his recognition and acknowledgement that as time goes on, he was witnessing the countless number of people who were benefiting. And not only that, he was noticing the many trainee therapists and then therapists who were utilizing it and feeding back how much it was helping their clients. And then the people that were writing to him who just simply read his book, hadn't even gone to see a therapist, and it changed, and some even said saved their lives. Was witnessing other approaches stimulated by his own. As I mentioned last time, Marty Seligman acknowledges the influence of REBT on his development of positive psychology and particular aspects in it. Beck, Tim Beck acknowledges and acknowledged the influence of Al. Many others have, many others haven't, and yet it's pretty clear that they stand, as I said last time, on the shoulders of Albert Ellis. So it was him observing the impact, his desire, his excellence at it. It brought him joy.
Very good. And as far as his influence on others, I think Emmet Felton wrote a book called Under the Influence, where he detailed Al's influence and the REBT influence on many other theories and approaches.
Yeah, and the late Emmet Felton, unfortunately, he's no longer with us, but He passed away quite tragically a few years ago. He did a lot of work helping people suffering from issues of addiction, and he and Al wrote a book about that. And he was a large part of the development of what is now called and was called Smart Recovery, which is a secular body to help people who want to help themselves overcome, be victorious over tendencies of addiction.
Right, right, very good. And I think Al also mentioned that another reason he was able to write so many books was a lack of perfectionism on his part. And is it true that his first draft was what he sent to his editor, and he didn't spend a lot of time going over it again and again and again?
That's pretty true. He would go over it when the editors sent back any suggestions, which, by the way, was rare. If anything, it was a little tweak here or a request for clarification there. But yeah, Al wrote all of his books, at least in the time I was with him, by hand. He was a very fast
Typist?
Typist, thank you. That's getting an outdated term now, isn't it?
Right, right.
He was so fast. In his later years, arthritis prevented him from being as fast as he used to be, but he was still very, very fast. But in the years I was with him, he would handwrite them in, felt tip pens, softer and easier to flow. And send them in. And often he was working on more than one book at the same time. And you are correct. He actually, in one of the last talks that he gave at a conference before he succumbed to pneumonia in 2006, this was conference at the very end of 2005, he was answering some questions, and there was a question related to that. Someone was talking about being afraid or not, procrastinating on writing, and Al was saying, well, if you don't think you need to do it perfectly well, you just do it.
Right, exactly. Yes, thank you. You had mentioned last time, which was a surprise to me, that he did meditation. And I have more and more clients who, along with REBT, do meditation. And as you probably know, there are different types of meditation. There's compassionate meditation and other kinds. Do you know what kind of meditation he did?
Yeah, he would consciously breathe, just breathe in deeply and breathe out deeply, and at times repeat a peaceful word like relax, 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 coordinating that with the breath. It was as simple as that. It wasn't a spiritual form of meditation, but it was to calm his busy mind and help him often to either have a little cat nap between episodes of work or to drift off into sleep.
I see. Thank you. When I first started getting interest in REBT in the 60s as a result of reading some of Al's books and seeing him as a client, that led me to want to be a therapist. And I went to some professional conferences at the time and spoke to other psychologists and psychiatrists and mentioned I was interested in Albert Ellis's work in REBT. And there was a lot of rancor toward that at the time, and a lot of criticism of Al, criticism of the method. And over the years, that has changed dramatically. These days, when I tell another therapist about what I do, they often say, oh, yes, I do some of that. So could you explain why there was so much aversion to REBT in the early days, and why you think that's changed so dramatically?
Yes, indeed. So in the early days, psychoanalysts ruled the roost of psychotherapy. And they criticized Al. Al first presented his approach, REBT, at the annual convention of the American Psychological Association in 1956. I love saying that was before I was born because then I feel young. But it was. Anyway, it was in Chicago, and he used to say, and even he's written about how people there booed him and called him stupid and simplistic and superficial, him and his approach, both. He was attacked and so was his approach. And yet he didn't let that stop him. He practiced what he preached. He would have liked the approval of his peers, but he didn't need it. And he had such conviction in the benefits of his approach. So he persisted. So, I think that was one of the reasons for that negativity, that on the one hand, people comfortable with their way didn't want anything to threaten its position. They compared his way with theirs and judged his way as inferior. I hope this isn't true. I have no proof. It's just a speculation that maybe, and I hope a minority of psychoanalysts like the fact that it was very long term. I mean, to think of it in a positive note, they may have thought that it gave the client opportunity to go in more deep and so forth. And it also, paid for some pretty nice holiday houses. Anyway, do I sound skeptical? And REBT is such an effective brief therapy. Now, certainly, people suffering from certain psychoses or really more complicated neuroses and emotional disturbances do benefit from more sessions of REBT than some who can really change their lives in just a few. But psychoanalysis, especially then, was very long term. And so anyway, that I think those were the main reasons Al was criticized, that people didn't like how short term, and they equated that with superficial and simple, and you don't go deep enough. The reason I think that has changed, there are a few reasons. One is Al's approach heralded the cognitive revolution in psychotherapy. Even though Adler before him had certainly some elements of cognitive therapy, and Al acknowledged them, but there are also remnants leaning towards a psychoanalytic view of things or aspects of it. So Al was the first full force cognitive approach, which also integrated the emotions and the behavior. And as a result of that came CBT, positive psychology, and so many others. So I think that's one of the reasons that the people who realize REBT came first respect it so much. I think another reason, especially in recent years, is its holistic nature. And the fact that Al, in his final years, and I do my best to do this, we highlighted, trying to get the tenses right here, the holistic and spiritual nature of it. When I say spiritual, I don't mean religious, but perhaps better to say philosophical. So it's not only a no-nonsense, pragmatic, here are the techniques, here are the tools, evidence-based approach in psychotherapy. It's imbued with compassion. Other cognitive approaches don't emphasize the importance of unconditional acceptance like REBT does. And so I think that's its broader appeal these days.
Okay, very good. And thank you for that, Debbie. And when you say it's philosophical, in what way is it philosophical that differentiates it from other approaches which may not be philosophical?
Well, it really invites us to reflect on what is our view of life? What is our view of one's own life? And most importantly, do we have any unhealthy attitudes? Do we have any irrational beliefs at the core of our expectations about how our life should be? And if we're able to identify that indeed we do, then we can reflect with the help of REBT or any similar common sense approach that such demands are great setups for distress, depression, anxiety, and other unhealthy negative emotions. So REBT is not simply an approach that wants to help us alleviate symptoms. Of course, that's part of it, but that's only a part of it. REBT wants a person to have a talk about deep, a deeper healing experience and learn to be their own healer in that sense by understanding their part in creating their emotions by the way they think. So that philosophical element is inviting people to explore their life view. Is it rational? Is it irrational? If there are irrational elements in it, are you willing, person who's working on themselves, to really question that logically, pragmatically, Socratically, as REBT disputing invites us to do, and then come up with healthy new philosophy of life. And with that healthy new philosophy and attitude, with some gratitude thrown in, as REBT recommends as well, life simply, no matter how many challenges arise, has greater tranquility and stability and more joy.
Right. Wonderful, wonderful. Having been Al's partner for many years, you probably have some memories of some of his wit and humor. I certainly saw when I did groups with him, and I went to his workshops, his humor. But does anything come to mind when you think of particularly funny, pithy, witty things Al said over the years just in daily life with you?
Oh, many things, Michael. But what's coming up to mind now is something actually last time we spoke, and I think I said then, if there's time later, I'll share this story of how Al applied humor in a very literally life-death situation. So maybe now is the time for that.
Okay.
But spoiler alert, anyone who's very conservative may not find it funny. Oh, well. But anyway, here it is. And again, it literally took place in a life-death situation. So a few months before Al's 90th birthday, he was sitting on the side of the bed. It was 4 a.m. or something. He would regularly check his blood. Being a brittle diabetic, if his blood sugar was high, he'd inject himself. If it was low, there was always some orange juice or a snack by the bed. Anyway, this particular morning, he's sitting at the edge of the bed, and then he sort of falls back and his eyes roll in his head. I call 911, ambulance, get the ER. His vitals are very low, and they do a CAT scan and this and that. And what's quickly discovered is that the whole of his large intestine was massively infected and about to burst. It could have burst at any moment, which would have killed him. And so they had to perform immediate emergency surgery to remove the whole of his infected large intestine. And, they were telling me this quickly and that they would remove it and there are risks involved and so on, but it's all going well. He would have an ileostomy bag and he could get back to work, because I was asking, I knew that would be one of his major concerns, and that he could resume a normal life even with the ileostomy bag, all else going well. So as they're literally wheeling him in for surgery, and I'm at the side, I'm explaining what they told me to him, and he says, "Oh, they're removing my large intestine, all of it." Yeah, but you'll be all right. And without blinking, he says, "Well, at least they're not taking my balls."
Yeah, it's very good. Yeah, I've actually read that in one of the books he wrote about that.
Yeah, and if you think about it, that was typical of his sort of humor. But
Yeah,
he nearly died.
yeah,
He was on his way to surgery. And so as an example of him, I guess, having been in the habit of looking, or just almost automatically being able to see a humorous side of things, to interpret something in a witty kind of way. And doing that, I'm not saying it made him happy about what was happening, but it certainly reduced anxiety, which would be an understandable emotion that most of us could feel in that situation.
yes. And also it seems like, getting back to philosophy and REBT, it seemed like it reflected an underlying philosophy of life that he had, which is nothing's awful, nothing's horrible, just very, very bad, just advantages and disadvantages. And that's a great illustration of that.
It is, and that was one of the things he was criticized for as well. When people called him superficial and this and that. What do you mean nothing is awful, they would say. And some people are very invested in catastrophizing, a word he created, by the way, that's now part of very common lingo. And frankly, unless something kills one or one is in constant 24-hour pain, with the exceptions of those situations, truly there's a lot of evidence in people who have survived atrocities that if one is willing to adopt a life-embracing, healthy attitude, then one still can have meaning in life. Maybe less pleasure, less joy than if the tragic events hadn't happened, but it's still possible to have some joy and some meaning if one isn't invested in whining and framing tragic events as the worst that they could be. If you're alive, they're not the worst they could be in practically all situations.
Exactly. And I remember him saying on a number of occasions, and even if it kills you, well, that's not awful, because then you'll be out of your pain and we'll make you a splendid funeral. Some more humor from Al.
That's right, yeah. And often, when he would encourage people to do homework, that was a bit of a challenge for the client, push yourself to say hello to a stranger in a safe place if the person had social anxiety. That was a stretch for them. But then Al would add, as you indicate, that line, and if it kills you, we'll give you a nice funeral. Sometimes he would add, but it hasn't killed too many people yet.
Right. Exactly. Well, we don't have any more time right now, Debbie. So again, it's been a great delight speaking with you. And there are many more aspects of Al and elaborations of these things that we can discuss. So let's definitely make it again sometime in the future.
I would love that. Count me in. Yeah, and I love your questions, Michael, and they really give me an opportunity to share things that a lot of people wouldn't know. So you're providing a great gift to people who are interested in Albert Ellis and REBT and work that you and I do in continuing his mission.
Thanks so much for saying so, Debbie. And again, I'd like to thank our guest, Dr. Debbie Joffe Ellis, a premier REBT therapist. And if you enjoyed this interview, please give us a like and please subscribe to the REBT Advocates to stay on the rational side of life. Thank you very much, Debbie.
Thank you, Michael. Bye, everyone.